Different communities experience different health outcomes and have different access to the resources and opportunities they need to achieve their full health. And that's not a random occurrence or something that happens by mistake. And that can be anything from things like banking and financing, to access to parks and green space, to higher education, to housing and transportation. Any serious effort to undo health inequities would require shifting the balance of power.
The beauty of advocacy, the beauty of self-organizing communities is that we have the solutions. Communities hold the knowledge, the wisdom, the data that we need to implement policy solutions that actually change our systems, change our environments for the better.
Our issues are interconnected, right? Our issues around housing, wages, income inequality, the issues of healthcare and health debt, and so many other things.
We're seeking justice, a way in which communities can break away from these poverty cycles that they have been in for so long.
When we're able to see our humanity, then we're able to understand that healthcare is a human right and everybody deserves to have healthcare.
The sum is greater than the parts. Together, we can say, okay, this is a way that we can build the power of the patient voice, the public voice, the community voice in these health policy decisions that are being made every year.
When we look at the stories that are told and sort of the media narratives that exist about why people's health status is what it is, we see the majority of stories really focusing on the individual. Our work is really broadening to that landscape frame and telling the broader story of communities and of systems.
We should always be pushing towards the next strategy that can have the biggest impact and create the most flexibility and creativity and long-term ability to work on change for the communities that we are all in and working on behalf of.
It's super important that we continue to provide the leadership development to members of our community for them to be able to advocate for their own communities so that we can collectively amplify our voices and ensure that our voices are heard.
Having long-term resources to plan deeply with community, to plan deeply with those who have been most impacted by the health challenges is so incredibly important. The biggest challenge for the government institutions is to make sure that they're fully responsive to the needs of community. And the only way to do that is to be really deeply connected with community partners, the people who are on staff in health departments, in collaboration with health departments to help plan and make change.
The social bonds bring to the table those community organizations that were not at the table before. And for us to have the responsibility, the beauty of inviting those grassroots organizations now to the table and share what was given to us is a privilege. And it is essentially transforming the way that we will do the work here on out.
This investment is predicated on top of the core support that the endowment and other foundations provide. That core support is crucial. That provides the flexibility, that provides the ongoing support and sustainability for us to do our work.
Through this investment, we are going to not just build people power through the voices and through the organizing, but we are thinking of this accountability process that needs to happen. This is a long-term investment. The impact will be a shift in accessibility for people to have ultimately access to healthcare.
We are the good troublemakers
Of California.
Together,
we can bring
Change
and health justice
For all Californians.